Hi, hello. I hope anyone who finds this video is well. We are not going to talk about a reflection point, a meditation point for today. I just wanted to share something personal. So, in the past years, actually, I've been more and more stressed with my primary profession, which, as you can guess perhaps by now, by looking at the videos, I'm a clinician, I'm a physician. And don't get me wrong, I love seeing patients. The smile and the gratitude they can give you if you help them, not even so much as cure them, but just to lend a helping hand to them is priceless. But more and more in the past few years, it's been stressing me more and more out. And I won't go into the details why. That's not really the purpose of this video. But I realized, especially in the past few months, that I needed to do something. I can't and I do not want to live the rest of my life just doing my work, my career, but really being drained and burnt out in the process. I don't want to lose myself in my career, so to speak. So I reflected and I realized that actually, even before entering medical school, the one passion, I wouldn't even call it a strategic decision, but it's really a passion, a hobby, even if you want to use that term. The one passion I have always had is teaching, lecturing, educating. During college, I'd always sign up for these peer-to-peer tutoring and review sessions. Come medical school, I was also part of, eventually becoming the head of our review sessions for the different medical subjects. During specialty training, I also had that particular fondness for teaching, lecturing, and I brought this habit, this passion with me up until now. And reflecting made me realize that maybe I should gravitate more towards this passion, this hobby, if you will, because I never really considered, at least before, I never really considered teaching as a viable career for me. For me, of course, I wholeheartedly applaud all those who are full time in the academe. Though who knows, maybe that's where I'm headed in the future, in the near or in the distant future. But I wholeheartedly applaud those full time academics who have really made it their passion, their vocation, their career to teach. But for me, it's always just been, a side gig. But I knew I needed to do something with my career burnout. And so I did. I started applying, and thankfully, thank God, I did become accepted as a part-time lecturer in the medical school I came from. This year, I also started as a part-time lecturer also in the university, this time in the college degree program where I also came from before medical school. So I've been increasing my teaching load more and more in the past few months, and boy, it really changed me for the better. I was pleasantly surprised with the difference, the positive difference it made in my life. It certainly made me less grouchy, less moody, and it's hard to explain, but there's a certain fondness, a certain happiness. It's different from the happiness I get when I see my patients getting better or thanking me for what I do for them. But it's a different kind of happiness I get when I see my students understanding the topic I had to teach them, I was assigned to teach them. It's a certain different kind of happiness I feel when I'm really in the zone lecturing this particular subject. It's quite hard to describe, or maybe it's not really meant to be described conceptually anyway. But I'm thankful that I embraced more and more and am embracing more and more this supposed passion, this supposed side gig of mine. And I realized that maybe I, and perhaps by extension us, maybe we shouldn't confine ourselves to just one particular career, just one particular profession. Let's say, oh, I trained and I studied to become an attorney, and therefore I will be attorneying for the rest of my life. And that's the only thing I'll do. Of course, you can do that if you're happy doing that. Kudos to you. However, if you're not, perhaps you would like to explore those other passions, those other side gigs, which perhaps we forgot or pretended to forget along the way. For me, that was teaching. And so, what happens now in the future, I really don't know. Let's face it, no one really knows what will happen in the future. Maybe I'll still continue being a clinician, maybe. Will I become more and more spend my time, my energy in the academy? Maybe, perhaps. Perhaps I'll grow old and die teaching instead of being a clinician after all. Who knows? But yeah, my supposed side gig perhaps saved me, if you will, from the exhaustion my original career had been giving me. Thank you very much for listening, and I'll see you again in our next video. Stay safe.